The pre-administration blood component checking process. Blood components must only be administered by trained, competent, and authorized registered healthcare professionals. Does your local policy require a single or a double independent check by registered and regulated professionals? What is a double independent check? The second professional must repeat the checks after and independently of the first professional. The bedside checking process. It is recommended that a checklist should be used at the patient's side as part of the final administration check prior to transfusion. See local policy. Check instruction, consent, and TACO risk assessment. Check observations. Check medications. Perform visual inspection. Check component details. Check patient identification. Step 1. Check the instruction. Is the component type correct, including the rate, volume, and any specific requirements specified? Check the instruction has been signed. Check the patient details on the instruction matches the patient's ID band or equivalent. Step 2. Visual inspection. Check the pack for any signs of damage or discoloration. Do not use and return to the transfusion laboratory. Step 3. Check the component details and equipment. Is it the correct component? Check the blood component is compatible with the patient's ABO and D group. If you are unsure about compatibility, do not proceed. Contact the transfusion laboratory, transfusion practitioner, or consult your local transfusion policy. Do the donation numbers match? Check if there are any specific requirements. Check the pack has not expired. Check you have the correct transfusion giving set. Step 4. Check the patient's identification. Ask the patient to state their first name, last name, and date of birth. Check the details match the patient's ID band or equivalent. If there is any doubt regarding the patient's identity, do not proceed and escalate. The compatibility label attached to the blood pack must match the details on the patient's ID band, including the unique patient identification number. Please be aware. If using a double independent check, the initial checker must investigate any errors before the second check takes place. If you are interrupted or distracted during the checking process, you must restart the process from the beginning. Always administer components immediately on positive completion of the checks. When double independent checking, ideally, the last professional to complete the checks administers the component. If a supplementary check is required, for example, by unregistered staff, this should be completed before the accountable professional's check. Finally, check the transfusion has started at the correct rate and complete the documentation according to your local hospital policy. If you're in any doubt regarding any step of this process, do not transfuse. Escalate and contact your local transfusion practitioner or transfusion laboratory for clarification.